Our next paper is from the PCPLC and is to be presented by Dr. Eustina Kwon from Seattle with her mentor, Dr. Sam Rice-Townsend. The paper is titled Fecal Continence Disparities in Patients with Idiopathic Constipation Treated at Referral Institutions for Pediatric Colorectal Surgery. Dr. Kwon.
Good afternoon. My name is Eustina Kwon. I'm a research fellow at the Seattle Children's Hospital. Thank you for the opportunity to present our work here. We have nothing to disclose. Functional or idiopathic constipation is a very common disorder, and it is estimated to affect 9.5% of children worldwide and account for 2.5 million physician visits annually in the US. When it is severe, constipation can be associated with fecal incontinence. Most children are successfully treated with medical therapies, but when these modalities fail, they are referred for further workup, including surgical evaluation and intervention. Previous studies have suggested that social, economic, and education levels may be associated with differences in constipation rates, but it is unknown if there are disparities in outcomes or access to care in this population. We aim to evaluate the prevalence and severity of fecal incontinence and associated demographic characteristics in children with severe functional constipation referred for surgical evaluation. We queried the Pediatric Colorectal and Pelvic Learning Consortium, or PCPLC, database, which is a multi-centered consortium of pediatric colorectal and pelvic reconstructive specialty centers that maintains the first comprehensive database on the management of pediatric colorectal diseases. All pediatric patients 3 years or older with functional constipation were identified through the PCPLC database over a 6-year period. Fecal continence was defined as being free of stool accidents, and this was further categorized as complete, daytime, partial, and no continence based on the timing of the accidents. We identified a total of 458 patients with functional constipation. The median age at diagnosis was 4 years, and the majority of patients were male, of white race, and non-Hispanic or Latino ethnicity. More than half of the patients had private insurance, while 36% had public insurance. Roughly 30% of our cohort had undergone an ACE procedure. We also captured patients' psychiatric comorbidities, and 41% had some type of psychiatric diagnosis, with the most common being autism spectrum disorder, followed by ADD and ADHD. In terms of prevalence of fecal continence, 71% of this cohort reported some degree of incontinence, with only 26% describing complete fecal continence. When looking at patient characteristics, fecal continence was more common in older patients. Race and type of insurance also correlated with fecal continence in the univariate analysis. Black or African American patients appeared to have higher continence rates when compared to white patients. Private insurance was also appeared to be related to higher percentage of continence patients. And patients with developmental delay showed decreased proportions of complete continence, whereas other psychiatric diagnoses did not show an association with this difference. Odds ratios were obtained using multivariable logistic regression. Type of insurance and race were significant predictors of fecal incontinence. We found that compared to patients with public insurance, those with private insurance were at lower odds of fecal incontinence. Additionally, Black or African American patients were at 75% lower odds of incontinence than white patients. Age at first visit was also an independent predictor. Patients who were younger than 5 years were at 2.4 times the odds of fecal incontinence compared to those who were older than 10 years. Ethnicity and psychiatric anomalies, both of which were included in our regression models, were not independent predictors for fecal incontinence. So in conclusion, we found that in the cohort of patients with significant constipation referred for surgical evaluation, difficulties with fecal continence was common, and affected by age, payer status, and race. Patients with public insurance were observed to be at higher odds of associated fecal incontinence compared to those with private insurance. And further studies are needed to further investigate these findings of potential disparities in care. Thank you.
Thank you. This paper is open for discussion.
I really shouldn't comment since my name is on the paper. I know a decent amount about it, but I want to say I love the PCPLC. We're part of the PCPLC, but this data reflects a lot of the early patients who were enrolled from a lot of very busy tertiary centers. So I just wondered how you could comment on how that might reflect now that there's more sites enrolling more patients who are not at tertiary center, how that might affect this data going forward.
Yeah, thank you for that question. We understand that that is definitely a limitation to using the PCPLC database, especially because this is information taken at one time point where patients who visited these specialty centers after the age of 3, and the information, the data that we collected at their very first visit, at their very first referral. So that is definitely a limitation in terms of the cohort of participants in this study.
Dr. Gaines.
So are you surmising that the disparity exists in the referral process, that children aren't getting referred to the specialty centers to begin with, or is there something different happening at the referral center?
If you can remember the demographic information, there were only 5.5% of the cohort being Black or African American, which to us did not represent a complete picture of patients with severe constipation who may need surgical evaluation and intervention. And the fact that it may not reflect the overall picture of everybody with severe constipation kind of indicated that there may be disparities in access to care or the referral system even before they visited one of the PCPLC specialty centers.
Okay, thank you.
Thank you.